Hello and welcome to Healthy Living. I'm Dr. Donald Pelto, and today I have Dr. Sean Lordan here and Dr. Samantha Santiago. They are both physical therapists in nearby Worcester region. Welcome to the show, guys.
Thanks, Don.
You're welcome. You're welcome. Sean, tell me a little bit about your practice in terms of physical therapy, where your practice is at, and kind of what you enjoy doing about your job.
No, that's great. So thanks again for having me. Really appreciate it. And so we've been open for a few years now. We're located in Sutton, Mass, which is about 10 minutes south of Worcester, right on Route 146. We're actually right next to a CrossFit right now. So we see a lot of CrossFit injuries and sports injuries in general, but we're primarily an outpatient sports and orthopedic clinic. So we see anything from pediatrics with torticollis all the way up to, 90-year-old hip fractures and really anything in between. But, my personal specialty, and it's funny that, we're talking today, but my personal specialty and interest is the foot and ankle. I really love foot and ankle from an orthopedic perspective.
Yeah.
I think everybody's got their sort of niche in what they like to do and what they like to treat. And for me, it's foot and ankle, probably followed closely by shoulder, and then low back. We see low back is 50% of what we see in the clinic. And I recently just took a spinal manipulation course. So I'm certified in spinal manipulation now, which is pretty cool. But we do, we like to stay cutting edge. All of our therapists have advanced certifications and subspecialties, so I like, dry needling and spinal manipulation, and Sam and Christine are certified in women's health. I've got a therapist who's, again, dry needling certified. I've got another therapist along a track of becoming board certified in orthopedics like myself. We've got all different specialties. We've got a therapist that's certified in vertigo training and vertigo rehab.
Yeah.
We kind of hit, we've got 6 providers, 6 PTs. We're all doctors of PT. We try to be, I myself have worked in over 10 outpatient practices, having gone through Northeastern and done the co-op program and gone through all my residencies, and having worked for a couple different practices. So I've seen the good and the bad of every PT clinic that's out there. And I've tried to take the good pieces from everywhere and really try to put them all together at the concierge. And another really super exciting thing before I hand it over to Sam to talk about women's health is we're actually getting a gravity-assisted treadmill delivered within the next 2 weeks, which would be really neat for potentially for some of your patients as well. It can offload. We're getting the Ultra G Via unit, which is an incredibly expensive treadmill, but it does a number of things, and beyond being able to unweight the body up to 80% without having to get into a swimming pool or a disgusting, HydroWorks tank that's, cleaned once a week. It's actually got the ability to analyze gait. So what it can do is it will tell you exactly how much weight you're putting on each foot. It will show you your step length, your cadence, and your stride length. And it's like a nice little printout. So you can see almost it's objective data before and after. So day 1 of your treatment and maybe, week 4, week 8, week 12, and it'll show you the improvements that you made and how equal your step length or your step, the weight of how much you're distributing your weight.
So for those that are watching, they might not be familiar with an Ultra G. So explain kind of what it is and kind of what it looks like. I know what it is, but maybe some of the people listening aren't familiar with that, or who would be a good candidate to be seen by using that. Are you going to rent it out? Some people rent it for people to do running and training and things like that.
So we haven't decided on the model yet. We're just going to incorporate it into our regular physical therapy routines and see kind of how that works. We may do some gait analysis programming. And just kind of, that might be a sub thing that, we'll make available to the public if they're interested in, and their gait, their cadence and that sort of thing. If they're avid runners, they really want objective data on how much weight they're putting on either foot, or, what their stride length, their step length is, their cadence. Those are really important metrics if you're a high-end runner, because you want to be able to look at that and improve that. There's a lot of research that shows actually decreasing your stride length during longer runs can reduce impact up the chains. So there are different things that we hope to do with the treadmill, but in general, it's going to be easy to get on and off. It's not a huge step to get in there. And basically what you do is you put on a special pair of shorts, you hop in, and we press a button, and it starts to unload however much weight we want to take off of your body at that time. So it's going to be excellent, I think, for ACL rehab. It's going to be great for post-op anything. If we don't want them to, let's say their weight bearing is tolerated and they can't tolerate all their weight, right? They're on an assistive device. What an excellent device in order to, really make it easier and pain-free to introduce a pain-free gait pattern back to, to their brain pathways, right? For neuro-rehab. So I think it's going to be a really cool opportunity to kind of test our own knowledge and to push our own rehab protocols and see if we can get people back to normal faster by, kind of inhibiting that pain cycle that a lot of people, as PTs, we're always taught, hey, weight bearing is tolerated. That means get rid of your crutches, get rid of your rolling walker, and just blast through the pain. This might be a nice opportunity to really help people build a neuro-rehab chain and some neuroplasticity without the pain cycle.
That's
so
awesome.
Really excited about that.
You guys seem like you're kind of forward thinking in terms of when it comes to technology and things like that. Yeah. So before I forget, I think if people that are watching, they're kind of interested in this in your clinic, how can they learn more? Is there a certain website that they should go to learn more about your practice?
That's great. Thanks for asking, Don. So it's conciergephysicaltherapy.com is our website. That's find more about our providers, and so that's everything is pretty much listed there. But I've got a book coming out soon, more deep than that.
Cool.
Talk about our women's health subspecialty.
Awesome. So I think at this point, I think we cut out a little bit. I'm going to ask Samantha to talk a little bit. I know originally what I was interested, I think you guys left some things here, and I was learning or talking a little bit about women's health and especially like pelvic floor issues. So Samantha, could you talk to us a little bit? Well, welcome first of all, and tell me a little bit your interest in women's health in terms of these pelvic floor issues and other types that are specific issues to women.
Well, thanks for having us, first of all. I'm glad you got the brochure and are interested. Well, women's health was something, it's a specific niche that we covered in PT school. It's something that I was interested in and kind of browsed the area for, someone to look to and see more about it because it's a very small percentage of the population. But essentially, women's health covers everything from, the pelvic floor and issues with incontinence, both urge, stress, mix, just having to go to the bathroom, whether that's, postpartum or later in life with other neurological issues, to, the stretching of the abdomen and having diastasis recti, and even chronic low back pain. So it's, the pelvis is the center of gravity. It's the middle of our core, but it can cause an array of issues. And this specifically, sometimes people aren't sure which provider, if you don't want to go to the medication route, maybe it's something structural or postural that we can fix without medication necessarily. And it's in the bigger cities. It's, popular in other countries, and now it's kind of trickling into the suburbs. So it's something that I'm interested in and really excited to provide to the Worcester area.
What's interesting, Samantha, is I think a lot of people, and I think the joke is I have this talk with my mom. My mom, she said, "Don't make me laugh." I'm like, "Well, why? I'm going to pee." I'm like, and so people that are listening, that's a real simple thing. If you had a baby and now that when you laugh, you pee or other things like that, that's like pelvic floor a lot of times. Is that correct?
Yeah, that's a huge part of it. And, there's a stigma that it's common, so it's normal, but that doesn't necessarily mean that it's normal. It's also an imbalance, and it's something that we shy away from and don't necessarily like to talk about. But think of the pelvic floor aside from, the sexual organs and the urinary issues. It's a cuff of muscles very similar to, the rotator cuff or even the complex little muscles of the foot, how one muscle can switch the balance of the entire shape and structure.
So for those that are listening, they might not be aware of a pelvic floor. We kind of alluded to a couple of examples, and you said it's kind of like a whole bunch of muscles that are it's on the bottom underneath your lungs, right? And kind of in that area. And explain kind of what happens, like, and why it needs treatment, and then kind of what are some of the treatments that you guys can do, kind of going a little bit deeper in that.
Sure. I actually have a model here, if you don't mind me bringing that out.
Always helps.
So we have the pelvis, we have our lumbar spine, and then we have, our hips, and then our sacrum. So for the purposes of this, I'm going to remove the bladder, which sits right in front of the pelvis.
Hold it up a little bit higher there on the side. Yep, perfect.
There. So I took out the bladder, then I'm taking out the female reproductive organs, and then I'm taking out the rectum as well. So when you remove that, and then you just rotate, so that is actually a cuff of muscles. Levator ani, and there's both superficial and deep, where that supports, it's your undersling of your entire trunk. So your organs and everything sit on top. And then, your hamstrings attached right in the back, you have your glutes, in the front, you have your adductors. So all those muscles that we work out at the gym attach to this subset, our structural midline, essentially. So, we work out the big muscles around, both above and below. Everyone works out their lower abs, their quads, their hips. They know to stretch. But, at the end of the day, all of that is supported by these small muscles.
Wow. And I'm probably I don't know, this is like everyone else that's listening to us today. How do you strengthen, or how do you evaluate if there's problems with it? Is it an MRI? Is it a physical exam? How do you determine that?
So, the first part is just talking about it. Once you're comfortable enough to put all that aside and actually talk about what your issues are, you'll find out that the community is larger, and a lot of people suffer in silence. So whether it's stress incontinence, so what that means is, like the example you use, like laughing, coughing, getting up too quickly, you almost forget to brace, and that similar mindset of if you don't use it, you lose it. It's something that you can retrain yourself to do, and that's where pelvic floor therapists come in, and it's very specific.
Is that you? You're a pelvic floor therapist? That's
yes,
you.
Myself and Dr. Christine here at Concierge.
So good. Yeah, tell me more. That's interesting.
Yeah, so it's great. It's just a lot of it's retraining. So whether it's one end where you're hypomobile and everything is hasn't been strengthened in a while and everything's weak, we tend to have prolapse, urgency. You tend to go more. The people who go just in case, that just because it's common doesn't mean it's normal. So fixing that, average, you should be going to the restroom 5 to 8 times a day.
Okay.
And unless it's a neurological issue, going to the bathroom multiple times at night is not normal. But often, if you fix the daytime issue, you should be able to sleep through the night.
Okay. Wow. And let's talk a little bit, explain kind of for someone, let's say someone has this issue. They may have Googled it before, kind of looking online. Are there like exercises people can try before they come in? Are there like home therapy, or like how does one learn about this stuff? I guess I don't have the problem, so I haven't Googled it too much.
Well, a lot of it is just the standard, like, oh, I know what a Kegel is. Like you and I have probably heard of Kegel. It becomes standard language, but 6 out of 10 people don't know how to do a proper Kegel.
Okay.
And,
so tell us what a proper Kegel is.
So a proper Kegel is it's a suction and lift of the pelvic floor. So essentially you're tightening the pelvic floor.
Okay.
But what happens, or what we think of it as, is stopping the stream of urine. So you just think of being able to, stop your stream, but that in itself is not necessarily a Kegel. We might be compensating and using the muscles we do know how to activate, like our glutes or our adductors or our other, our hip muscles. But those big muscles are endurance muscles. That's what we use for standing, sitting, structure, running. But we should be using these tiny muscles to hold up our pelvic floor so that we can then use our bigger muscles to do the things that we want to be doing.
Wow. And how successful in your experience is treating this? Is it something that you teach them you teach them exercises and they come back every couple of weeks for maybe 6 or 8 weeks? And are you finding improvement? Are you finding, what are some of the testimonials, I guess, of some of your patients?
Oh, well, that's great. Well, I've just recently started, so I've been doing this for less than a year, but I have a mentor here in the area, and that's exciting. We exchange stories, and she's readily available for cases that I haven't seen. But I'm very excited to say I've already had very positive feedback.
Good.
Some of it is global musculature. So they go to their, urogynecologist or gynecologist, and they're like, we've tried all the medications and it's still not great. And because people are usually suffering for a longer period of time, women's health PT tends to be once a week.
Okay.
In the span of 2 or 3 months, sometimes longer, depending what you need. And a lot of it is just patient education, confirming that you're doing things correctly. And then in a week, people are coming back and saying, you know what, I went to the bathroom twice last night instead of 6 times. My husband noticed. They told me, like, oh, you didn't wake up that often last night. You must have slept well.
Yeah, it has to be like life-changing for these patients.
It is. I know people aren't going out too much now in general, but just talking to a lot of people, there's a lot of anxiety. Like, when you go to the grocery store, like, I'm going to go to the bathroom before I go. And then when I'm there, going up and down the aisles, knowing that there's a restroom available. And with COVID, sometimes the restrooms are blocked off.
Oh.
And then saying, like, you know what, I'm not going to go. I'll have so-and-so go in my place because I'm just not sure that I can hold it for the ride, grocery shopping, and then the drive back.
Wow. It's interesting, Samantha. I think those that don't suffer with it, or those that, you deal with it now, is there statistics, like what percentage of females deal with this in their lifetime? Is it like 50%, 80%? Is there other statistics out there, or what are your thoughts?
There's different statistics, but it's very widely underreported.
Yeah.
So, I mean, if you go in, the grocery store or even a convenience store, there's an aisle dedicated to supplements. Like for example, like wearing a pad or wearing like an adult diaper, but that's basically a Band-Aid. That's fixing, the
kind of the embarrassing problem that happens. Yeah. It's not really fixing the real problem.
Right. So instead of worrying about leaking, if there's, exercises you can do 10 minutes a day, and then you know that you can hold, and you don't have to necessarily wear an adult diaper for the rest of your life. That's something. Or even someone who's younger and they associate this with older people, you can fix that now.
Or they had a baby, or like you talked about other things like that can change that. Now, isn't this something like who should be diagnosing and referring to you? Is this something like, I would assume a primary care should be the main one diagnosing and referring? Do they in fact ask those questions and refer, or is that what's happening, or a lot of them just kind of, they don't know much about it or who to refer to, so they don't?
Correct. That's why a lot like this conversation is super powerful. Just having it out there and knowing that, if you have this issue, you can go to your primary care and bring it up. And if you don't feel comfortable doing that, or you haven't seen your primary care recently, this is something you can bring up to a gynecologist, a urogynecologist. Even your orthopedist, because this could be something with chronic low back pain. You've tried everything, similar to, I think you and I had that conversation about how the foot hits the ground, that just the foot in itself can be a predecessor for low back pain. Sometimes like the obturator internus, all these tiny hip muscles could be the one key that unlocks the door to decreasing low back pain altogether.
Interesting. It sounds like you're passionate about this area, Samantha, and it's kind of one of those hidden areas that people are embarrassed to talk about. So I think it's really great that you guys are doing this focus. So great. And I'm just I think we broke up a little bit before we talked about your website where they can get more information, Samantha, about kind of this pelvic floor work or this types of treatment. What's the website that they can go to?
So our website is conciergephysicaltherapy.com, and we can provide you a link as well.
Yeah.
And if there's Sean has it laid out, so there's a little box at the bottom. So if you do have an inquiry or interested, you can speak to myself or Christine. That message will be forwarded to us if you'd like to speak before even coming in, bringing it up.
Am I a good candidate for this type of therapy?
Correct.
Oh, perfect. Well, great. I think we covered a lot of information. This is something that was totally new I think I've talked to my partner, Dr. Feldman. He broaches this sometimes with his patients, and we don't realize how many people really suffer with this. So thank you, Sean. Thank you, Samantha, for talking about this topic once a year. They're from Concierge Physical Therapy. And thank you for your time, guys.
Yeah, it's our pleasure. Thanks, Dom.
Hey guys, thank you for watching Healthy Living. You're going to find a few links here I'd like you to click. One is to subscribe to this channel on YouTube. Also, you can learn more. There are some videos here you can see.